What is a ketogenic diet? Hi everyone. How are you? Welcome to the High Fitness by Weakness channel. Today I'm gonna share with you how the ketogenic diet works. The ketogenic diet is classified as high fat and low carbohydrate. If you want to feel extremely light and feel great, turn off carbohydrates from your daily menu and replace them with fat. His method is used, among others, in the treatment of drug-resistant epilepsy in children. The ketogenic diet is a high-fat and low-carbohydrate diet. About 35% fat, 50% carbohydrate and 15% protein are consumed in the daily diet. In the ketogenic diet, fat can constitute 80 to 90% of the energy supplied, and the remaining 10 to 20% is combined with protein and carbohydrates. Carbohydrates are the body's main source of energy. When they are missing, the body begins to look for another fuel. These are fats, specifically ketone bodies, so-called ketoses, formed in the process of fat breakdown. However, they provide the body with only 70% of the energy it needs, so it is malnourished. After a few days of using the ketogenic diet, a person enters a euphoric state. This is how doctors determine the effect of ketones. They have excellent mood, are cheerful and light. After 2 to 3 months, everything passes. Appear loss of appetite, drowsiness and constipation. The smell of sweat, urine and breath changes and thirst increases. The ketogenic diet helps fight disease. It has found application in the treatment of drug-resistant epilepsy in children and in some congenital metabolic errors, for example congenital lack of GLUT1 glucose transporting protein. There are also other indications for its use, such as Rett syndrome, Dravet syndrome, epilepsy with myoclonic seizures, DUS syndrome, and tuberous sclerosis. Therapy supporting the ketogenic diet in autism, Alzheimer's disease, Parkinson's disease, other types of epilepsy or some encephalopathies is also being considered. It has not yet been explained why the ketogenic diet reduces the frequency of seizures. High fat supply with a negligible amount of carbohydrates in the diet leads to changes in fat metabolism, similar to fasting. From the fat, ketone bodies are formed in the liver, acetone, acetostate and beta-hydroxybutyric acid, which penetrate the central nervous system and constitute a substitute, in the absence of glucose, energy material for neurons. Ketosis, that is a high concentration of ketone bodies, is observed in the patient's blood and urine. However, they are only indirectly responsible for the anticonvulsant effect. Ketone bodies are suspected of cause an increase in the activity of enzymes synthesizing aminobutyric acid, which inhibits the stimulation of neurons. And they activate the K2P potassium receptor and the sodium-potassium pump, which raises the seizure threshold. In addition, ketone bodies can protect nerve cells, including against damage from free radicals. They reduce oxidative stress. In the ketogenic diet, remember to supplement the deficiency of some vitamins. A ketogenic diet leads to a shortage of some nutrients. Therefore, when using it, remember to supplement preparations containing calcium, vitamin D, water-soluble vitamins and some trace elements. Currently, several versions of the ketogenic diet stand out in the treatment of drug-resistant epilepsy. Traditional, based on short-chain fatty acids. Based on fats rich mainly in medium-chain fatty acids, MCT, and a modified Atkins diet. People with liver, kidney and pancreas disease and diabetes cannot use the ketogenic diet. The traditional ketogenic diet generally uses a 4-1 or 3-1 diet, that is 4 or 3 grams fat accounts for 1 gram of protein and carbohydrates combined. Dietary fluids are limited to 60 to 665 milliliters per kilogram per day. The diet begins in the hospital, under the control of a doctor and dietitian, preceded by starting it with a 1-2 day fasting. Then gradually the amount of energy and nutrients administered increases up to the values determined according to diet assumptions. Further treatment is carried out at home and usually lasts 2 to 3 years. During this time, you must strictly follow the rules of the diet, because any deviation from the norm can promote epileptic seizures. A ketogenic diet for cancer? Some argue that a ketogenic diet can be used to treat obesity, diabetes, cardiovascular disease, chronic fatigue, hypertension and even cancer. However, experts emphasize that there is no evidence confirming the effectiveness of the ketogenic diet in people struggling with malignant tumors. What's more, switching to a ketogenic diet during cancer can result in complications due to the increased amount of metabolic products in the body. The ketogenic diet works on slimming. During the ketogenic diet, the body does not draw energy from carbohydrates, but from consumed and owned fats and protein, which is used by people who want to get rid of unnecessary kilograms. In addition, ketone bodies suppress hunger. What are the side effects of the ketogenic diet? Adverse effects may occur during the ketogenic diet. At first, the patient may complain of constipation or diarrhea, vomiting, abdominal pain, which usually disappear after the body adapts to the diet. Accompanying symptoms are tiredness, drowsiness, loss of appetite or thirst. With prolonged use of the ketogenic diet, urolithiasis and hyperuricemia, increased blood uric acid levels, may occur. And that's it for today. Now you know how the ketogenic diet works and how to apply it. I hope you enjoyed today's video, and if you are looking for something that can really help you lose weight, please check the link in description. Don't forget to subscribe to the channel and click the notification bell to receive new powerful videos. If you like this video, give it a thumbs up and leave a comment below. Have a great day and see you in the next video.